Very good evening to all of you. So today we will start with the aphorisms belonging to the provings. So before going into the part of the provings, some things about the provings which we need to understand first. Although the more we will start with the part when we will go through the aphorisms, we will talk about it. But there are few things which we need to understand for the before we start with the proving. There is just an outline about something. Our whole knowledge of materia medica, it comes from the process of proving the medicines. When the medicines they are given on the healthy individuals to know what kind of medicinal properties these medicines contain. So along with the discovery of similia similibus currenter, along with the discovery of um, the homeopathy itself, the discovery of the provings, it was a very big thing. Why it was, we will, when we will go through the aphorisms, we will talk more in more detail, but it was a very big thing for the science. Before this method, the proving of the medicine on the healthy human beings, the medicines or the action of the medicines were seen on the sick people. If even now, if there is some drug, some new drug, uh, first we label that drug as an experimental drug, that we are making experiments with this drug. So some volunteer patients are chosen, 100 patients or 200 patients who voluntarily want to test this experimental drug. They are chosen. So those patients, they are already sick. So then the medicine is given and then we see whether their symptoms are reducing or not. Even now, this thing is going on. Whenever some new drug is coming, whenever some new medicine, some cancer medicine, some immunosuppressant, when they are launching, before launching there is a study, but the whole study is done on the sick people. So in these aphorisms, Dr. Hahnemann will tell about this thing, that why we cannot get a clear picture of any medicine when we are basically testing it on a sick person. Why we cannot have that thing. The study of the homeopathy, the other part about the proving, the study of the homeopathy, it started with the proving. When Dr. Hahnemann, he took that China, he proved that medicine. So the whole discovery of the homeopathy, anything, the similia similibus current, anything which came afterwards, that all basically began with the proving. When the proving was done by Dr. Hahnemann on himself, and he saw that after taking China, he is getting all the symptoms of malaria. So from there it all started. So proving is basically a base of everything the homeopathy is basically standing on. Nowadays we don't do much of provings. We have materia medica. But when Dr. Hahnemann started proving, there was no materia medica. There was no pro forma for case taking, nothing. When he started proving, he started getting symptoms. He came to this knowledge that I can ask about these symptoms when I'm taking the case. So even the case taking has come out of the provings, because he started understanding that these kind of symptoms rise in the patients. So I can ask about the stomach pains, or I can ask about the this kind of headache. I can differentiate between the headaches of 5 or 7 medicines after he started proving the medicines. So the materia medica, there was no materia medica for Dr. Hahnemann. Materia medica came afterwards, case taking came afterwards. The first, he started with the provings of the medicines. So with that, we will start with the aphorisms on provings. Because nowadays, I was going to tell that nowadays we don't do much provings. We should do, because by proving, we can know for certainly how the symptoms come. But still, if we are not doing the provings, we need to understand the materia medica has all come from the provings. The repertory has all come from the provings. Many times we just stick to the repertory, we just stick to the rubrics which are there in the repertory. Many times when I'm talking with the doctors, when I am giving some lecture, when I'm in a workshop, I always tell that rubrics are very small part of the symptom. Even if we are taking a rubric, if there are some medicine, we must go back to the proving or the materia medica to see how this symptom was displayed by the patient. Then only we can understand. If there is fastidiousness in arsenic album, in proving it was more of sensitivity to disorder. That was the expression, that he was too sensitive, he cannot, it was painful sensation when he would see disorder outside him. In his surroundings, when a patient is seeing disorder, that the things are not kept properly, they are not in a good shape, or in a, he it was intolerable for him. So that language of proving what the patient expressed tells us more about the medicine, more about the symptom, because repertory is a very, very, very small part of the provings. Materia medica, okay, there are many kind of materia medicas. There are the materia medicas of proving, there are the clinical materia medicas, then there are comparative materia medicas, and there are some materia medicas which are just on the mental part of some remedy. But again, the main source is the provings part. That is the main source. We cannot understand the hypnotic state of Crotellus cascavella if we don't look at the provings. There is a rubric, magnetic states. Rubric is of magnetic states. But when you go in the proving and you read about the Crotellus cascavella, it's a completely different thing. That magnetic state basically comes down to the hypnotic state, as if the person is under the hypnosis of someone and he is doing as he is asked to do it. So completely change of meaning happens. So we'll start with the proving, the aphorisms on provings. Aphorism 105. The second point of the business of a true physician relates to acquiring a knowledge of the instruments intended for the cure of natural diseases. So the second point of the business, after the case taking or after understanding the basic mechanism of finding the symptoms or knowing about the symptoms, the second point of the business is to know about the instruments which are going to cure, means the knowledge of how the medicines work, how the medicines act, what kind of powers the medicines have. Investigating the pathogenetic power of the medicines. Many times in the Organon, the word is used as the pathogenetic power. Patho means disease, genetic means producing. Dr. Hahnemann has always told in the sense that the medicines, the power which the medicines have, it is the disease producing power which we use to cure the disease. So the medicines, they don't they don't contain the power to eradicate the disease. This is a very important point to understand. For example, arsenic, if it is given to a person, it will cause some symptoms of the arsenic poisoning. Merxol, mercury, if it is given to some person, it will basically cause some symptoms of the poisoning. There will be an aphorism, I think 110 is the aphorism, where he tells about this thing in more clarity, that the doctors have been observing this thing, that the medicines or these substances, they basically contain the pathogenetic power. They wrote down that a person, he took the arsenic and these were the symptoms. He started vomiting, he became weak, he became very, the palpitation was there, the anguish was there, the anxiety was there. So he said that all these power of the medicines were the same power which is the curative power. If any patient comes with all these symptoms, Although he is not poisoned, but he has this symptom, and you give him a dose of arsenic, he will start becoming better. How he becomes better, it has already been discussed in the previous aphorisms with the primary action and the secondary action and the therapeutic law of nature. All those things we have done already. I just wanted to say that everywhere, whenever the power of the medicine is basically dictated or told about, or some adjective is used to tell about that thing, it is always pathogenetic power of the medicines. In order, when called on to cure, to be able to select from among them, from the list of whose symptoms and artificial disease may be constructed as similar as possible to the totality of the principal symptoms of the natural disease sought to be cured. So we have to investigate into this power. If, for example, if we take something, for example, water does not have any kind of pathogenic power in it. It is a very neutral substance. So it also does not have any power to heal anything. Onion, the raw onion, if you eat it or even if you peel it, it has the power, it affects the human being and we start lacrimating. Slight coryza and lacrimation starts from the raw onion, from the pungent smell of the onion. So that is a pathogenic power of the onion. When you eat chilies, some green chili, it basically starts, burning in the mouth, and some erosion or some this thing may happen in the mouth, some inflammatory process. That is the pathogenic power of that substance. It produces some symptoms. It produces unease in the body, dis-ease in the body. So that is the power of the medicine, power of the substances when they are acting on us. And we use the same power of those substances to cure similar symptoms. That is why we have to find among the list of the medicines which has the same kind of pathogenic power. There are the symptoms which we have taken in the case taking. From the materia medica, we take out the medicine which have the tendency to produce such kind of symptoms, and then we give that medicine to us. That is similia similibus currenter. So aphorism 106, the whole pathogenic effects of the several medicine must be known. The pathogenic effects, they should be known wholly, not in some parts, not in the part of head, not in the part of arm, but on the whole body. What kind of effects they produce. That is to say, all the morbid symptoms and alterations in the health that each of them is especially capable of producing in the healthy individuals must first have been observed as far as possible. So any kind of symptoms, any kind of alterations that they can produce in a healthy individual, not in a diseased person, but in the healthy individual, because a healthy individual does not has any symptoms yet. So all the symptoms which we will get when we start proving that medicine, when we will start giving that medicine to that person, all those symptoms will be of the medicine, not of the individual. They will be all of the medicine. So we can have a very clear picture of the symptoms which are there, which are coming to the patient. If it is a sick person, then the sickness, the symptoms of the sickness plus the symptoms of the medicine, they will get confused. We will not be knowing that whether the patient is basically giving the symptoms of his sickness or they basically belong to the medicine. So it will be a very confusing thing. So that is why the best thing to do is to do it on the healthy individuals. The first reason. The second reason is, person when he is already sick, if you are giving him some medicine which will aggravate him, his condition will deteriorate. His original disease might deteriorate. He might not be able to go through that experiment. So the purpose will not be solved. before we can hope to be able to find among them and to select suitable homeopathic remedies for most of the natural diseases. So first the proving has to be done. We have to know about the medicinal properties. We have to know what kind of pathogenetic power they have before we can use them on diseased people, on sick people. But other experiments on the drugs are completely opposite. The experiments are done on sick people, and the medicine is given to sick people without knowing the whole pathogenetic effects. The purpose is to find the whole pathogenetic effect. So if we are giving some medicine for the find a medicine and giving to a sick person who is suffering from some heart disease, and after taking the medicine there are some symptoms in the kidney, we don't know whether the disease has shifted or these are the symptoms of the are the pathogenetic powers of that medicines. We don't know clearly about it. So usually a subsection is written about the side effects, but we don't know about the side effect, whether some symptoms are coming because of the medicine, the drug, or because of the kind of metastasis of the disease. So aphorism 107, if in order to ascertain this, medicines be given to sick persons, now the same thing only, even though they be administered singly, even if we are administering the medicine singly and alone, then little or nothing precise is seen of their true effects. The whole thing, like we have talked about it earlier also, that truth is very important. That is why again and again in many aphorisms you will see this word again and again. So anything which can alter the state of truth, that is never allowed in homeopathy. Even in case taking, if there is something which will alter the picture of the true picture, it is not allowed. In proving, if there is something which can alter the true picture, it is not allowed. As those peculiar alterations of the health to be expected from the medicine are mixed up with the symptoms of the disease and can seldom be distinctly observed. So those symptoms they will mix up, the symptom of the medicines and the symptom of the disease. For example, this medicine, whichever we are proving, it has uh, the power to increase the symptom which is already there in the patient. So if that symptom will increase, for example, the patient you had a headache or had fever or some kind of fever or the thirst, he had thirst in the fever. So this medicine also have the power to increase thirst during the fevers. So after giving the medicine, if that symptom is getting aggravated, we don't know whether it is the disease symptom which is getting aggravated or it is aggravating due to the effect of the medicine. The picture will not become clear. So we will not get the true pathogenic effect of the medicine. There is therefore no other possible way in which the peculiar effects of medicines on the health of individuals can be accurately ascertained. So there is no other way to understand the effect of the medicine. There is no sure, no more natural way of accomplishing this object than to administer the several medicines experimentally in moderate doses. The thing is that the medicine should be given in very moderate doses when we are experimenting with them. Two healthy persons in order to ascertain what changes, symptoms, and signs of their influence each individually produces on the health of the body and of the mind. What kind of symptoms are produced on the body and the mind of each individual? Now, this process, like there are sometimes these things that the homeopathic medicine does not have medicine in it. Sometimes these type of things comes that the whole cure is done, although we have shown cases so many times, or we have seen those cases where where it is not possible, that only the placebo can get this kind of effect. But still, when these kind of, so there is this thing that when in the provings, when the medicine is given to, like for example 10 people, without those people, they don't know about what medicine is being given. Those people don't know what kind of symptoms are being produced by this medicine. They're just being given the medicine. After the medicine is given, they are told to tell what kind of symptoms they have. And when the 10 of the patients, they have similar kind of symptoms, they all are having several similar kind of symptoms, without knowing the medicines, without knowing the materia medica of that medicine. They don't know about it. They are not even doctors. So they don't know about it, what kind of symptoms will come. So when again and again the same medicine is producing same kind of symptoms, so that tells us something about the medicine. That yes, this medicine or these medicines, the homeopathic medicines, they have the power to change the state of health. So they have some power in them. They can influence the health of the human being. So if they have the power to influence the health of the human being, then the same power is used basically to cure the diseases. So it is a very clear and clean example, a clear and clean experiment by which it can be ascertained that these medicines can or do have this kind of power. There is no need to go in the laboratory and search whether there are nanoparticles, whether there is something in this or not. Just give the medicine. Tell the person, take the medicine and let us know how you feel after taking the medicine. So when these changes are coming, administer the several medicines experimentally in moderate doses to healthy person in order to ascertain what changes, symptoms and signs of their influence each individually produces on the health of the body and of the mind. So in the proving also, we are not only talking about the symptoms of the body, but also the mind. What kind of changes in the mental health, in the mental state? Because any medicine which is given, it changes the state of the mind also. There is always a change. Because the medicinal, anything which has medicinal property in it, anything which has pathogenetic property in it, it cannot produce the change in the body without producing the change in the mind. Those aphorisms will also come later on. That is to say, what disease elements they are able and tend to produce, since, as has been demonstrated, all the curative power of medicine lies in this power they possesses of changing the state of man's health and is revealed by observation of the later. So the same thing which we have talked about, that the curative power of the medicine, it basically, we have already discussed in aphorism 24 to 27 about this thing. So that curative power of the medicine is the same power that is the pathogenetic power. How it basically changes the state of the health. Footnote to aphorism 108. Not one single physician, as far as I know, during the previous 2500 years, thought of this so natural, so absolutely necessary, and only genuine mode of testing medicines for their pure and peculiar effects in deranging the health of the man. So, Dr. Herman is saying that for past 2500 years, there was no one except, it will be coming forward, that who basically can think of this thing, that it is so natural and so common thing that if you want to check the medicine, the effect of the medicine, check it on the healthy human being and see how it is deranging the health of the man. How you will use it, either allopathically, either isopathically or homeopathically, that is a different debate. But for checking the power, for checking what kind of changes the medicine can bring, the sulfur, what kind of changes it can bring, it will be better to test it on a healthy human being in moderate doses, small doses, so that it does not disturb the vital force of the process And as soon as you will stop the medicine, the vital force will basically is capable of pushing the symptoms out, curing the symptoms whichever were there. So he's saying that this simple and genuine mode of testing the medicine for the pure and peculiar effects in order to learn what morbid state each medicine is capable of curing, except the great and immortal Albrecht von Heller. He says that besides Dr. Hahnemann, only Albrecht von Heller, he basically thought about this thing. He alone, besides myself, says the necessity of this. Wide the preface to Pharmacopoeia Helvet. So there was a Pharmacopoeia at that time. So it was written in Latin. I have changed it to the translated into English. Certainly, medicine must first be tried in a healthy body. So this was a preface of that pharmacopoeia without any foreign mix. So first the medicine should be tried in the pure form and should be tried on the healthy body. Having examined its smell and taste, a very small dose of it. So it should be given in a very small dose of it is to be poured in, and it is to be noted that all the things that happen therefrom, the affections, what pulse, what heat, what respiration, what excretions should be noted. So any changes which are coming afterwards, giving a small dose, they should be noted. From there to guided phenomena in a healthy way pass on to the experiments in the patient's body. So from there we will pass on the same, we will be guided by the phenomena which we have seen in the proving, and then we will experiment it on the patient's body where we'll see the similar phenomena, or it may be used in the other way. But no one, not a single physician, attended to or followed up this invaluable hint. So he's saying that no one basically followed up this hint. It was a hint given in the preface, but no one followed it up. I was the first that opened up this path, which I have pursued with perseverance, that could only arise and be kept up by a perfect conviction of the great truth, fraught with such blessings to humanity, that it is only by the homeopathic employment of medicines that the certain cure of human maladies is possible. So he's saying that I am the first person who has opened this path, and I have pursued with perseverance. I have done everything with genuinity, with hard work. I have gone through this path, and why I have gone to get to the great truth, because he was very much had confidence in this thing, that that I am very close to that path, I am very close to that system which can basically come as a blessing to humanity, to cure the humanity, that there is so much bad going on with the medical system. So I'm very close to finding a system which can give hope to the humanity. So he had this conviction, he had this confidence, and that is why he was always had this thing in the mind, that there has to be something which can give answer to this sickness and everything which is going on. And he says that I am very much convinced, and I am, because he had done so many things, the conviction was not coming out of some kind of gratefulness or some kind of bloated mind. No, because he had already done so many things. If we look at the history of Dr. Hahnemann, he has done so many things. So after doing something, when you are getting something which is completely opposite to what you have been seeing, which gives you a insight into the truth, insight into the system, which have the answers to all the questions which have been put out by the nature in the form of diseases. So that is why he said that it is the only by the homeopathic employment of medicines. If you will employ the medicines, sulfur was given in an allopathic way also, and sulfur can be given in a homeopathic way also. Medicine is same. Medicine is same. It can be used to suppress skin diseases. It can be used to cure skin diseases. The way of giving is homeopathic. Like I have talked earlier also, that medicine is not homeopathic. The way of giving is homeopathic. A medicine can only become a homeopathic medicine when it is given in a right way. So that is what he is saying, that only by the homeopathic employment of medicines that a certain cure of human maladies is possible. It is impossible that there can be another true best method of curing dynamic diseases. That is, all diseases not strictly surgical. So except from the surgical diseases, he is saying that there is no other method which is best at curing dynamic diseases. Diseases which are coming from the dynamic origin besides homeopathy. Just as it is impossible to draw more than one straight line between two given points. Like between the two given points, we cannot draw more than one line. Similarly, it is impossible to find some system which is best at curing these chronic diseases, these dynamic diseases, except homeopathy. He who imagines that there are other modes of curing, he had done isopathy, he had done allopathy, he has done heteropathy, he had done everything before discovering homeopathy. So he's saying that I have already gone through this path. And I'm telling you that if you are imagining that there are other modes of curing diseases besides it, could not have appreciated homeopathy fundamentally, nor practiced it with sufficient care. So even after telling all these things which I have told, I have given the whole philosophy, I have given the whole principles, how to practice it. If someone is not able to appreciate the working of homeopathy, he's saying that then basically the thing is that he has not practiced it with sufficient care. The thing is that, homeopathy can only come. I was talking about this thing with some of my students today, that to grow a plant, if you want to grow a plant, for example, if you want to grow a plant of apple, yes, the condition has to be there, the water has to be there, the sunlight, the temperature has to be there. But even if all the things are in perfect thing, but the soil is not perfect, the plant cannot grow, the seed will not erupt, because the eruption of the seed is what happens in the soil. So even for the homeopathic seed to erupt, we need that kind of soil so that it can erupt. If the mind is already, the soil is already in a state where it cannot see beyond the things which are possible, if the mind is already closed to something new, if we are already opinionated, the homeopathy will not bloom in that kind of soil. There are certain things which have to be done. If there is no interest in knowing the truth, if someone is okay with the false perception that okay, symptoms are not there, disease is being managed, so the patient is well. If we are into that perception that basic work of a medical science is to manage the disease, not cure it, then we will never think about curing it. That is the difference between homeopathy and because in homeopathy the first thing starts from the cure. The first aphorism starts from the cure. Curing the sick to health. The intention or the seed which we are putting in the mind of a new homeopath is that we have to cure the disease, not find the cause of the disease, not find the diagnosis of the disease, not find the uh, some medicine to manage the disease. The first seed is of cure. See how many teams curing, cures in one aphorism, curing again here. 3 4 times Dr. Hahnemann has used the word cure, 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 so that a homeopath, a physician, can have this thing in the mind that the cure is a possibility. Because till now, even the patients, I am so many times surprised. The patient comes, doctor, can this be cured? Can allergy be cured? They are surprised because they are always told that this cannot be cured. When the child will be 12 years old, 13 years old, this will go away. That does not go away. That basically changes into some other disease at that time. There are few lucky people where the allergy will last even after 13 or 14 years. They're lucky that it has not gone further into some kind of dangerous symptoms. So until and unless we have that thing in the mind that we can cure, we will not think about curing. So that is why Dr. Hahnemann has written it so many times, that I have discovered a way of curing the diseases, not managing them. Because I have seen all the methods, I have done all the methods, I have practiced all the methods. And at the best, I was able to manage the disease. I was able to kill the pain for certain time. I was able to manage the constipation. I was able to manage the diarrhea, but they will come back again and again. That is what was the problem. So now I have found a way of curing the disease. And he was surprised why the people are not, getting this point. So that is why he has written that if someone could not have appreciated homeopathy fundamentally or nor practiced it with sufficient care, nor could he ever have seen or read cases of properly performed homeopathic cures. Because once, with an open mind, if someone see a homeopathic cure being performed, hears about some case of homeopathic cure, it will take him to a different level. This can happen. He will question, he will have this thing in his mind that, okay, I want to see it happening. He will be curious. Only a person outrightly rejecting that kind of thing will be a person who is not open and is very much opinionated. Nor, on the other hand, could he have discerned the baselessness of all allopathic modes of treating diseases and their bad or even dreadful effects, if with such lax indifference he places the only true healing art on an equality with those hurtful methods of treatment, or alleges the latter to be auxiliaries to homeopathy, which it could not do without. So there were some physicians who were saying at that time that homeopathy, okay, it can work, but it cannot work without allopathic medicines. Like, you have to go side by side. So he's saying that this is not what the homeopathy is. So my true conscientious followers, the pure homeopathists, with their successful, almost never failing treatment, might teach these persons better. So he had this hope that in future, so true conscientious followers, the people who will work in homeopathy with whole of conscience and pure heart, they will show that how this treatment, how homeopathic medicines they work in these cases. So I saw moreover that the morbid lesions which previous authors had observed to result from the medicinal substances when taken into the stomach of healthy persons, either in large doses given by mistake or in order to produce death in themselves or others. So he's saying that there are some previous authors who had written about the medicinal substances, that what kind of lesions or what kind of effects it produces in the stomach of a healthy person, whether they were taken accidentally in large doses or someone basically tried to commit a suicide by taking some kind of poison, or others, or under other circumstances accorded very much with their own observations, when experimenting with the same substances on the myself and other healthy individuals. Okay. So he's saying that I also saw the same lesions when I was experimenting with those substances on myself and other healthy individuals, and they, whatever they have written is right. Either the medicine or those substances were given accidentally in large doses by mistake, or someone tried to commit a suicide and then they saw these kind of lesions after taking some kind of poisons. These authors give details of what occurred as histories of poisoning and as proofs of pernicious effects of these powerful substances. What are the pernicious effects? What are the harmful effects of these powerful substances? Chiefly in order to warn others from their use. So he's saying that they have written all these symptoms, that arsenic was taken and this kind of symptoms were coming, and they have written it to warn the others, so that do not ingest it, do not take it. It can produce this kind of ulcerations, this kind of lesions in the stomach, in the esophagus, in the mouth. Partly also for the sake of exalting their own skill when, under the use of the remedies they employed to combat these dangerous accidents, health gradually returned. And partly to exalt their skill, to make their skill better, that they used some remedies to um, kind of antidote the effects of these things, and the health gradually returned. But partly also when the person so affected died under their treatment in order to seek their own justification in the dangerous character of these substances, which they then termed poisons. But also when someone died under their treatment with the same medicines, same poisonous substances, they said, okay, they are basically pernicious substances. Some they get better, some they don't get better. To have a loophole, kind of loophole. None of these observers ever dreamed that the symptoms they recorded merely as proofs of the noxious and poisonous character of these substances were sure revelations of the power of these drugs to extinguish curatively similar symptoms occurring in natural diseases. So the same thing which we were describing about the pathogenetic power. He's saying that none of these observers, they understood this thing, that this disease producing power of these poisons is the same power by which they can cure the similar symptoms when they are occurring naturally. If someone is having that kind of lesion in the stomach, in the esophagus, in the mouth, coming naturally, some kind of cancer, some kind of necrosis, if the symptoms are similar, then these poisons, when given in small doses, can cure those symptoms, can cure those diseases. That these their pathogenetic phenomena were imitations of their homeopathic curative action. That this whole pathogenetic phenomena, the pathology which they are producing, are the intimations of their homeopathic curative action. That when they will be given homeopathically in a similia similibus curanter way, they will act as curative on the patients. And that the only possible way to ascertain their medicinal powers is to observe those changes of health medicines are capable of producing in the healthy organism. And the only way to see this power is to understand, to learn all these symptoms which are being produced in the healthy organisms by these medicines. For the pure peculiar powers of medicines available for the cure of diseases are to be learned neither by any ingenious a priori speculation nor by the smell, taste, or appearance of the drugs. We cannot understand about the medicine, how it smells, how it tastes, or by the appearance, or by some kind of speculation, nor by their chemical analysis, nor yet by their employment of several of them at one time in a mixture. If we are mixing the medicines and giving it to someone in the disease state, we cannot understand from that state. By doing the chemical analysis of sodium chloride, we cannot understand the symptoms which natramure can produce. By smelling or tasting the calcium, we cannot understand the symptoms or the kind of uh, diseases the calcarea carb can cure. It was never suspected that these histories of medicinal diseases would one day furnish the first rudiments of true pure materia medica. So the histories of medicinal diseases, the diseases which the medicines produced. Mercury was being given for gonorrhea. There were some other symptoms which the mercury was producing on the patients. Sulfur was being given for the rashes or some skin diseases, and it was producing some symptoms internally in the patients. So Dr. Hahnemann is saying that this history of medicinal diseases caused by the medicines, that no one suspected, no one even thought about it, that it will one day become a rudiment, the stepping stone for the true pure materia medica, which from the earliest times until now has consisted solely of false conjectures and fictions of the imaginations. All the materia medica is saying that which he had at that time, all the materia medicas, he's saying that it is basically full of fictions and conjectures, theories which were imagined, speculations which were imagined, that is to say, did not exist at all. So he's saying that till now, no pure true materia medica has ever existed. Again, many times, like I have, when we started with the Organon, I said that try to understand the emotion behind the Organon. If we read these 3 or 4 aphorisms casually, someone uses, without understanding what is behind it, if we just read it casually, superficially, it might appear that Dr. Hahnemann was a very haughty person, very self person, pompous person who had self importance, and he thought that I am the only one who knows, no one else knows. That kind of person. Some might even think that he might be platina or veratrum album. But when you go behind this thing, that is what Dr. Kent writes about. Okay, when Dr. Hahnemann's children were sick, it produced humility in him. He became humility, not humiliated, but there was a humility that I don't know anything how to cure this, how to cure my children, how to cure my patients. I don't know it. So that state of not knowing, like we always talk about that when you want to understand something new, when you want to understand some patient, we have to go to that state of not knowing, that I don't know anything, what to do. Then the real knowing starts. So whenever his children were sick, whenever his patients were sick, his relatives were sick, he was so tired of using every method, everything. And he came to that conclusion that I don't know what to do. I don't have anything to do. I have become a doctor. I have a good practice, but I don't know what to do. I cannot cure. I cannot give relief to the patient. Let alone the patient. I cannot give relief to my children. They are getting sick. So from that tiredness, from that humility, from that state of humility, he has gone to a state. He has gone to a state from where he didn't knew anything to that state of knowing everything. So that journey gave him the boldness to speak the truth. His courage came from the truth. All that, this thing which he's saying, that no true materia medica has come till now, there is no true pure materia, that was the boldness to speak truth, that there is none. Understand this thing. People took it in the wrong way. They took it in a way that he is basically a critical person. He was just simply telling the truth, that no one has ever thought of this thing earlier. No one has ever done this thing earlier. Where someone has thought about it, he has given the proper reference of that person, that except me, he is the person who gave this thing in the preface to this. He has given proper reference of all the doctors wherever the observations before him were seen. in chronic disease also, in the Organon also. But what was not there was not there. It was not there. So his boldness, his courageousness comes from the state because he has gone through that journey. He has gone through that journey, and when he found it, he was happy to share it with the whole world. He was happy that when now we all the physicians, if we can understand this thing, we can cure the patients, not only manage. The true cure can come where a patient can be healthy. But still, when there was something, people would say him to be a critical person, to be some many things were said about him. So that would hurt him again and again. That I am why you have closed your minds, why you have become so much opinionated. What difference will it make? For example, if you will try homeopathy, the worst thing can happen is that medicine will not work. That is the worst thing which can happen. Nothing more can happen. But think about the best thing which can happen, that the patient can get cured. So this was his thinking process from where all these things were coming up. So we have done today till aphorism 110. Next time we will continue from 111. So any questions, if there are, please do send that to Dr. Jonkol or to Dr. Rishabh or in the group also, and we can talk about it next time. So thank you and have a very good night and a good day.